who survived a stabbing yesterday is improving in the hospital. That's the word from officials in Virginia. They've upgraded the state Senator Deeds' condition from fair to good. But police say his son is dead from an apparent suicide. Remember, investigators say there was some sort of altercation yesterday. They haven't been specific, but it happened between the senator and his son Gus at their home. The senator was reportedly bleeding from his face and chest, multiple stab wounds, but managed to walk to the end of his driveway. And that's where investigators say a cousin or a family member spotted him. Police say Gus Deeds, the son, died at that home after apparently he shot himself. The autopsy scheduled for today, we should know conclusively soon. Friends say Gus Deeds was close with his father and former college classmates with the Richmond Times-Dispatch. I should say, classmates told the Richmond Times-Dispatch newspaper that he was a talented musician. The newspaper also reports the 24-year-old underwent emergency medical health evaluation on Monday, the day before all of this happened, and that officials released him because at the time they said there were no psychiatric beds available in Western Virginia. But Fox News has just confirmed that at least 2 nearby hospitals did indeed have beds available, but that authorities never contacted those facilities. Let's get to psychologist and attorney Dr. Bonnie Forrest, who's with us now live this afternoon. That's, you know, the sad news yesterday was this young man, 24 years old, goes in for mental health evaluations. They want to keep him overnight at least, but they say they have no beds. And as it turned out, they were wrong. And now he's dead. His father's in the hospital.
Yeah. Horribly sad case, Shep. I think part of the confusion stems from the stats around this. So, for example, the American Hospital Association reported that between 2002 and 2011, beds for psychiatric patients declined by 12%. You have other groups who say that they've declined by about 95%. Ooh. Interestingly enough, though, Shep, there's actually a specific Inspector General report from last year in Virginia, and they found a practice called streeting, exactly what happened in this case. 200 people who needed services were turned away. They have about 1,530 beds in Virginia, and 234 of those are unusable at times because of lack of personnel. And it's often the case that the burden is placed on the facility to find the bed, and when you're in a crisis situation, that's really hard.
Once it had been determined that he needed professional help and he needed to be involuntarily committed, if you're a parent, what are you supposed to do?
It's super hard, Shep, and I think you're really hitting on a crisis in this country. I mean, the number of parents that I work with, if you don't have an intermediate care facility, it is very hard. Starting in about 1999, you had states like New York who passed Kendra's law, and that's really an intermediate standard so that you can try to get somebody help, but there still has to be the resources available. And then even then, that's a very hard standard to meet. You've got to really show somebody's dangerous or about to be dangerous, or it's more likely they'll be dangerous. And time again, Shep, how many cases have you been reporting on in the last year where that's just not been the standard that's been met?
Yeah, many more than we'd prefer. Dr. Bonnie Forrest, live with us from San Diego. It's good of you. Thank you very much.